my dear viewers, we continue the topic of pregnancy and the factors that affect its bearing. I'm Dr. Olena Berezovska and I'm welcoming you at my YouTube channel. Let's talk about the task of a pregnant woman. What is the main task of the expectant mother? The first is to ensure the normal growth and development of the fetus by providing the necessary amount of nutrition and energy. In other words, a woman should eat normally and fully. The child does not choose the mother's view on food and diet. The child inside the mother does not give preferences to maternal taste. Therefore, it is extremely important to think about how some kind of diet, passion for some food, refusal of some kind of foods is necessary if we are talking about healthy offspring. I'm sure that the mothers of many women and men did not deny themselves a normal diet. Also, I agree that many women around the world are hungry and do not have a healthy diet. However, most women try to provide their unborn child with the necessary nutrition. I will talk about pregnancy and nutrition in another video, including the impact of different diets on the course of the pregnancy. And the second task of a pregnant woman is the adaptation of the female body to new physiological and physical stresses through providing herself with enough nutrients and energy, a change in metabolic processes for the utilization of energy and substances. This means that a woman must provide food not only for the child but also for herself. So there are two main tasks of a pregnant woman. This is the basis for carrying a pregnancy. If a woman takes care of her body condition, she will be able to endure her pregnancy with the least complication. A few words about preparing for pregnancy. I created a separate course, even a separate video channel. Women often ask me, if I didn't prepare for pregnancy, is that bad? Will I be able to bear such a pregnancy? And if I didn't take folic acid, and if I didn't take a lot of tests, and is that bad? Is it scary? If you are pregnant, this is a new stage in your life. It also tells you that your body is ready for pregnancy. You may not be ready mentally, but your body is already ready. Therefore, there is no need to dig into the past, worry that you did not have numerous tests, that you didn't take any medications, including folic acid, that you didn't run to the doctors. Maybe just life saved you from unnecessary worries. There is nothing wrong. But if we talk briefly about preparation for pregnancy, then it should be physical, psychological, mental, and material or financial preparation. Physical fitness means that a woman's body must be relatively ready to carry a pregnancy. Psychological preparation means a woman's willingness to perceive her new body condition and the arrival of a child in her life positively. In many cases, pregnancies are not planned. Most unwanted pregnancies end in abortion. This is the negative side of sexual relations. There are now different types of contraception available to many women and men, so abortion rates have dropped significantly in many countries. Not all couples are planning a pregnancy. However, there comes a time when one of the spouses or both are ready to create offspring. If one of the partners is not ready for pregnancy, it is important to discuss this issue openly. We also need financial and material preparation for pregnancy. Modern pregnant women visit a doctor or midwife much more often than women of previous generations. They take a lot of tests. All this costs money, and it is not always covered by insurance. Pregnancy monitoring is not free in all countries of the world. Private clinics try to make as much money as possible from pregnant women because they are regular customers for almost 9 months and even more. Also, considerable amounts of money will be spent on a newborn and everything he needs. What should a pregnant woman remember? During pregnancy, numerous changes occur in the body and with the body. The state before pregnancy is not the state of the pregnancy. It is enough to look in the mirror and see growing tummy. There is a huge difference. Women began to become pregnant and give birth less often, which means they have less experience and more fears. Knowledge comes with experience. Without experience, fear appears, which can also drown out the existing knowledge. There is also desire to reinsure yourself in everything. This often leads to unnecessary examinations, taking unnecessary medication and supplements. Women begin to get pregnant and give birth much later, even compared to my peers, and this increases the level of pregnancy complications. Women in the past have been getting married at 14, 16 years old for thousands of years, and only in the last 50 years has this statistic changed. Now, in many countries, women marry after 30 years. Also, in many European countries and USA and Canada, Australia, the average age of planning of the first pregnancy is 31, 34 years. There is no getting away from this statistic from public view when it is necessary to create offspring. All over the world, education is inflated for many years, then a career, looking for a job, a position, earning money, buying a house and a car, big loans. Living conditions have not only changed but also risen in price. This is understandable. No one wants to live in a hut. Therefore, the planning of the child is postponed until later. Modern medicine has become better than the medicine of the past. Better examination, better treatment, better outcome. However, there is still backwardness and false approach in medicine. There is low training of medical personnel, and this is a problem for the whole world. A commercial approach has also been developed because medicine often becomes a total business. Therefore, women who are planning a pregnancy, and even those who are not planning a pregnancy, should self-study, increase the level of knowledge about how our body are structured and works. It is necessary to understand the action of the doctors, not to be afraid to ask him questions. The poor outcome of pregnancy is not due to the fault of a woman herself. The blame of the woman is observed in those countries where the level of training of doctors and their actions are practically not controlled. A woman should not be left alone with guilt and pain that only she is to blame for all her problems, when in fact the level of medical error is very high even in well-developed countries. In no way I'm setting you up against doctors because I'm a doctor myself, but I also faced medical errors when I had health problems. Also, my close relatives suffered from such malpractices. What else it is important to remember? The internet is a source of knowledge, but as far as medicine is concerned, 90-95% of the information is inaccurate, false, incomplete, including information about pregnancy. Some of my colleagues conducted research to assess the truthfulness and reliability of information about several diseases on the internet, and it turned out that such information cannot be trusted for 80% of sources. Be careful, because most of you will not be able to judge the quality of information. I often repeat that pregnancy is not a disease. It is desirable that you understand too. Before you, billions of women got pregnant and gave birth, so humanity did not die out. Therefore, pregnancy is a continuation of humans. Also, there are certain unpleasant symptoms during pregnancy. This is not an ordeal that you are destined to go through. There is a lot of drama in life, but still take a pregnancy with joy. Your child does not need your stress hormone. When women become extremely worried, I usually give a simple example. Think back into your childhood. What kind of mother do you like? Did you want to approach your mother who was angry, nervous, pushed you away, referring to being busy and her problems? Did you like your mom under stress? Or did you want to have a mother who could hug you, kiss you, and protect you? Kind, sweet mother. I'm sure that you all have always liked and liked the image of a loving and caring mother. Try not to turn into angry and nervous, even if the child is inside of you and you do not see him. He fills you from within. Through your blood, many substances enter his body that are released during stress. For your child, your womb is a home outside of which he has never been and known nothing. The child perceiving everything that happens outside his house through your signals. When stress hormones appear in your blood, they can signal that something is not right in your body. For the child, there are also signals that something bad is happening outside the uterus. Try to remember that your child does not need your tears and stress hormones, your anxiety and worries. The best comfort for you is your child with you. If you cannot calm down on your own, turn to professionals, psychologists, psychotherapists, or psychiatrists. Stress can harm your pregnancy. Of course, the best cure for fear is knowledge. What else is important to know? Recommendations for examination and treatment of certain diseases are created by professional medical societies and associations, a group of experts, councils, but they are not mandatory. There are no mandatory guidelines for either physician or patient. Each country may have its own guidelines, but there are also many international guidelines, including in obstetrics. Protocols, which are often mentioned by doctors and nurses, are an algorithm for the action of medical personnel to examine and treat the patient with specific diseases. They may meet modern recommendations, but also have differences. This is often a step-by-step instruction on what to do when a patient appears in a medical institution. When a doctor complains that he is obliged to use the protocols, so he is obliged to perform such examination, these obligations are not obligatory for the patient. There is always an alternative. The patient has the right to choose and refuse. In any case, the doctor or midwife should explain to the pregnant woman why she is offered examination and tests, what are the side effects of this and the treatment, and there are other alternative options. There's nothing mandatory for patients. Everyone has the right to take care of their health the way they want. Also, in the event of pregnancy, the woman is responsible for her unborn child. Midwife, doctor, hospital, clinic provide services. Medicine is a service. They can be paid or free, it doesn't matter. Therefore, every person, including a pregnant woman, has the right to use the services in whole or in part, or to refuse such services. If you sign a contract with a doctor or healthcare facility, always read it carefully. Even if there is a contract, you must have a certain freedom of choice. You should not be punished for your choice. In some countries, there are pregnancy packages. I saw the contents of such packages and was surprised by the large number of unnecessary tests and procedures. These packages are not cheap, therefore in most cases they are banal pumping out of money from a pregnant woman's wallet. So be careful. Pregnancy has no critical period. The longer the pregnancy, the lower risk of losing it. Once upon a time, critical periods were a dogma in obstetrics. They were talked about in some textbooks, but no one really knew when these critical periods were. It is enough to remember that with the progress of pregnancy, the fetus matures. The more mature he is, the greater his chance of survival. In medicine and obstetrics, all diagnoses must be clear, have modern terminology. There can be no diagnosis with the word suspicion, tendency, threat. I will talk about this in other videos. Also, the level of pregnancy complications are determined by risk factors. We will also talk about them. Risk factors are not the cause of pregnancy complications. The factors do not lead to the onset of diseases per se, but the factors, especially in combination, can contribute to the onset of a disease. We do not know the cause of all pregnancy complications, but we can assess the presence of risk factors and classify a woman as a high, medium, or low risk. In obstetrics, we usually talk about high risk and low risk for pregnancy complications. The task of the midwife or doctor is to assess the level of risk in a pregnant woman and which risk group she belongs to. The presence of risk does not mean a bad outcome. This allows us to choose the right tactics for managing pregnancy. If you like this video, please like and subscribe to my channel. Do not forget to write comments and suggest topics for new videos. See you soon!